Alright folks, so now what I'm going to be running through with this demonstration is an example of the horizontal mattress suture. This is personally my favorite suturing technique. I think it has the most versatility with the best aesthetic outcomes from the interrupted sutures. Now certainly aesthetic closures subcutaneously will have better aesthetic results, but I find that this is a very good surgical closer and has many different applications. So let's get started with the same principles of the interrupted. I always start from the center of the wound, 5 millimeters from the skin edge, needle at 90 degrees to the skin. We're going to rotate that wrist through and come out of the wound. So this is a good suture technique for a wound that might have a bit of tension on it. So we made that first pass just like we would a simple interrupted. Take note of the depth that we exited out. We're going to enter at approximately that same depth on the side closest to us. We're going to rotate that needle through and exit about 5 millimeters from the wound edge. We're going to pull that through, and then we're going to reverse load our needle because we're going to have to backhand so approximately a centimeter in line with our exit from our first pass. We're going to rotate through, come out of the wound. We're going to rotate that needle a bit more, and we're going to go ahead and position our hemostat for our final pass with this suture. So we're going to be entering at the same depth that we exited, rotate through about 5 millimeters. From the wound edge. Now we can pull our sutures taut. Leave about a centimeter to centimeter and a half tail to tie. Usually hold the tip so I don't pull it through as I'm tightening. Alright. Then we're going to use the same technique for our simple interrupted with 2 forward passes over our needle driver. Grab the tip, and we're going to reverse hand to tighten to make that cinch down nice and tight. And then we're going to bring to the same side to lock it down. Then we're going to reverse over our needle driver, lock down the knot, and then one final forward in. Now, as in previous demonstrations, I'm using a 4/0 silk braided suture, which 3 knots or 3 throws for the knot are perfectly adequate for creating a tight knot that will not come undone. So we've got that first central suture. Now, as in the simple interrupted, we're going to divide remaining portions of the wound in half. So again, our needle point about 5 millimeters from the skin edge, 90-degree angle, rotate through. Enter at the same depth that we exited, rotate through, approximately 5 millimeters. And we're going to reverse load. Approximately a centimeter apart. For the final pass, we're going to enter at the same depth, rotate through, exiting ideally parallel to our entrance. So if it's a bit tight like this, you don't want to just drag it through, otherwise you're going to cut through your tissues. So you want to pull through, just make little small tugs so you're not sawing through the soft tissues. And 2 forward throws. Cross arm to tighten down. Reverse. And forward. And we'll cut our tails. Now our opposite side. Needle 90 degrees, rotate through at 5 millimeters roughly from the skin edge. Enter the opposite side at the same depth. Once we come out this side, we'll have to reverse load. Approximately a centimeter parallel. We'll exit. Entering at the same depth that we exited on the first pass. And you want to try to exit parallel to your initial entrance pass. And we'll tie 2 times around, cinch down. Reverse, then forward. Two passes forward. And we're down to our final suture for the closure. Just as the first one, needle 90 degrees to the skin. And we'll reverse load. Backhand, exiting parallel with our entry point. We'll rotate that needle through. Leave about 1.5 centimeters for tying. 2 forward throws. 1 reverse, and a final forward. And there we have our interrupted horizontal mattress. So, in order to remove these sutures, same principle applies as it does for any other suture removal, where you don't want the suture that's exposed to be dragged through the skin, and to avoid contamination and possible infection. So we'll grab our suture knot. We'll cut right at the skin. Then with our hemostat or our Adson, you can grab the exposed portion on the proximal side, and you'll cut that off at the skin, and you can remove the remaining portion without dragging any exposed suture through the skin. So cut at the skin. Pull through. Lift up. Cut at the skin. And pull the knot. Pull the knot. Cut at the skin. Pull the exposed suture out. Grab a hold of it, pull gently, cut it off at the skin, and then pull the knot. And continue following that same process until all are removed. On our final one, grab the knot, cut one limb at the skin, pull the exposed through or out of the skin, lift, cut at the skin, and then pull the knot. And that concludes our demonstration of the simple interrupted horizontal mattress with appropriate removal.